Hello, we're here with our very first podcast by the Gator Psychiatric Mental Health Nurse Practitioners. My name is Tanya Bellamy, and I'm joined by Deborah Hoisington, Selena Heesh, and Ashley Badal. We're excited to welcome our guest, Renee St. Laurent, who has been a mental health nurse practitioner for 9 years. She has worked at Centerstone Behavioral Health, Coastal Behavioral Health, Manatee County Jail, and Sarasota County Jail. She's an outpatient provider for adult and children, and she is actively involved with a local children's foundation, which specializes in foster children and their families. Renee, do you have anything that you'd like to add to this?
No, I think that covers it.
Hi, everyone. This is Deb. Thank you so much, Renee, for joining us today. We're really looking forward to speaking with you and for you to answer our questions. I wanted to start off by saying that while there are many different views and opinions in regard to prescribing controlled substances, there are certain circumstances that may call for them. I also want to acknowledge that with current regulation, this can be a fear task by many providers, especially new parents like us. And in the psychiatric setting, the topic of controlled substance may look a little different than in other settings, as we do not prescribe controlled substances in the context of pain management. So I wanted to ask our guest today, what are the controlled substances that you most commonly see prescribed in a psychiatric outpatient setting for both children and adults, and for what diagnosis?
So the most common controlled meds that we see within children would be the stimulants, and there's a definite increase in stimulants being prescribed to adults as well, who have maybe had ADHD for many years, but it was either more subtle or just got missed. The benzodiazepines are fairly uncommon with children, but very common for adults. I see them most being used for short-term concerns like panic attacks or phobias of things like flying or dental procedures during times of grief and loss and trauma. There's also a large population of older adults who were started on benzos 20 to 40 years ago and just never came off of them. They were indicated for long-term use at that time.
Hi everyone, it's Ashley. That's really interesting, Renee. In regards to stimulants, the guidelines do recommend behavioral treatment as a first option for very young children. Then a combination of behavioral therapy and stimulants for children ages 6 and up. However, non-stimulants are also an acceptable treatment. Have you had success with using behavioral therapy or non-stimulants instead of controlled substances, such as methylphenidate or amphetamine salts?
Yes, while I don't provide counseling for ADHD coping strategies, this is the first line treatment recommendation in most cases, and so I would refer out for that. Also, the non-stimulants of Antunib and Clonidine work very well for many of the younger kids with ADHD symptoms, and they're very well tolerated and have very rarely any major side effects as compared to some of the more common side effects seen with the stimulants. Strattera can also be effective, particularly in children and adults with co-occurring mood disorders like anxiety and depression.
Hi, this is Selena. As someone who really enjoys working with children and the adolescent population, I'm really interested in the safe prescription of stimulants. What are some of the pros and cons that you see to stimulant use? I'm also curious to know if you've had any cases of stimulant diversion or misuse in your own practice, and if so, how did you handle that? What are some of the non-stimulant options that providers can use in those cases?
Well, the pros are that they're very effective and they treat the diagnosis very quickly. They can make a huge difference in a person's quality of life when their symptoms are finally well controlled. Also, they're very safe when they're taken as prescribed for ADHD. The cons are obviously the high abuse potential, knowing that so many stimulants end up in the hands of high school and college students who use them to get more work done in a shorter period of time, or just to get that feeling of being high that goes with the addiction piece. So they also have a pretty significant side effect potential with affecting decreased appetite, weight loss, decreased growth in the little ones, and along with some mood side effects like irritability, agitation, depression, anxiety. Like other mood medications, they also can increase the risk of mood elevation to hypomania or mania. I have not been aware of any instances of my patients diverting stimulants, but that doesn't mean it isn't happening. Having a clear controlled substance policy for clients to follow helps with that. Expectations for random drug screens, pill counts, monitoring e-force, and other interventions can be done to keep patients safe with medication. Non-stimulant options I use for those who aren't able to take stimulants for one reason or another would include Strattera, Cymbalta, Wellbutrin, Intuniv, and Clonidine. Some of those are off-label. There's also a new non-stimulant as well, Qelbree, but I've not learned much about it yet and so haven't used it.
Well, that sounds great that there's so many different non-stimulant options, especially because of some of those cons that you mentioned. Earlier, we were talking a little bit about benzodiazepines as well. Although benzos are not really first line for the treatment of anxiety, they're sometimes used short term as like emergency treatment, as you mentioned earlier, while we're waiting for an SSRI to kick in for anxiety. Do you use benzos short term, and what are non-controlled alternatives to benzodiazepines for some short-term treatment of anxiety and panic? And do you use options like hydroxyzine instead?
I do use the benzos in the short term for reasons we talked about before. I'll typically use a non-controlled anxiety medication while waiting for an SSRI to kick in, though. Visceral or propranolol can be helpful, and sometimes a sleep aid like trazodone can make a big difference for people who struggle with mood and sleep.
Hey, this is Steph talking again. Thank you so much for this great insight and for these answers. It's really helpful for us. So I wanted to shift the topic a little bit. I work in an inpatient addiction center, and I'm really, really interested in that topic. As psychiatric CPRNs, we do not prescribe opiates for pain, but we are very involved with the treatment of opiate use disorders. As a result, many psychiatric providers do prescribe the controlled substance buprenorphine as a replacement therapy. Do you prescribe buprenorphine yourself or have any concerns with the use of buprenorphine in the context of addiction treatment?
I believe in the past month or two, the DEA signed off on allowing any licensed provider to prescribe the buprenorphine in an effort to improve the opiate epidemic. I don't prescribe it because it's not a function we're set up to do in the offices where I currently work, but I wouldn't hesitate to get some continuing education on how to do this if I were working in community mental health again.
It's Ashley again. Follow-up question. Have you had patients who were successful with that treatment or were able to abstain from opiate use?
Ashley, what was the question again that you were asking, Renee?
Me? Oh,
Yes. Have you had patients who were successful with that treatment and were able to abstain from opiate use?
well, that was my answer.
Renee, we couldn't hear you.
Oh, okay. Well, sorry. You want me tell me when to start and I'll say again?
You can go ahead.
Okay. Okay, yes, I've had patients that either went through the process and were successful and now in maintenance recovery. And I've had patients that are stable in treatment with another provider for the opiate wean and seeing me for medication management to address the mood component at the same time. So I've seen many patients succeed in addictions recovery.
Thank you for that. Yeah, we had a little glitch. Before we end this podcast, do you have any tips for us in regard to prescribing controlled substances as new providers? Also, did you feel hesitant about prescribing controlled substances when you first started prescribing them?
I think getting a sense of the controlled substance philosophy of the practice you are working with would help you feel more comfortable. I was hesitant with stimulants with adults until I started seeing how they impacted children and realized there was no need for that hesitation with regard to treating adults.
Okay, well, thank you so much for your time and thank you for joining us, Renee, and sharing your professional experience. Also, thanks to all of our listeners. We hope that this episode on controlled substances will be beneficial to your future practice as well as ours.